I'd say that intercalating was definitely worth it from my perspective. I learned lots of new skills, from lab techniques which you just wouldn't get the opportunity to do within the rest of the degree, to also independent study. So I was deciding my research projects. I did have lots of guidance, but ultimately it was down to me and I got to decide what I did.
I think intercalating was definitely worth it, and I think a big part of why for me it was worth it was because I picked something that I was really interested in researching, and it's something that I didn't realise that it would be the case, but even after finishing my intercalated year, my BMedSci, I've managed to carry that on. I'm in my final year now of uni, and literally as recent as a few months ago in June, July, I went to a conference in Vancouver to present my findings from my research, and that was probably a good 2.5 years after I finished my project.
I think intercalating was worth it. You get a lot more out of it than that I kind of anticipated. So I went to Bristol and I presented my work at a conference, which I never thought, it doesn't sound like a massive thing, but I thought it was quite cool.
And I managed to do a little bit more with my project as well during a period of time that you get in your 4th year to do a project of your choice. So I managed to carry that on to there as well. And it's just really helped with my learning as well, I think, of certain concepts in dentistry and throughout the course, and the way that I manage my time in my learning as well.
It was also really worthwhile because I got to spend a year looking in depth at an area which really interested me. And I also got to keep up my clinical skills because you do keep some clinics going during your intercalated degree. So I found I was as prepared, or if not more so, than other people when I started the 3rd year.
As well, from a dental kind of student aspect, we still had clinics once a week for the year, so it's you don't lose the skills that you'd learned in 2nd year, and you still get to see patients, so it's kind of you get a bit more time than everyone else does. So I don't know, I think it's really helpful, just being more of a confident professional individual.
Most of the students that do an intercalated year will definitely win at least one prize in something, just because of how well supported we are to achieve good results. Coming in with that as well, you get a lot of experience presenting and speaking in front of crowds of very highly qualified people as an undergraduate as well, which is a lot of pressure, but you learn a lot. You learn a lot of skills beyond just how to pipette or how to quantify a questionnaire or whatever it is your study might be or project might be. Being able to speak in front of a group of people is always a useful skill to have, regardless of where you end up.
You build tons of different skills, even just confidence and stuff. I think over the year increased because it's working with so many different people.
So yeah, I personally think it was very worth it, and I think most students who I know who have intercalated, none of them have regretted it.